Today we're going to talk about how HIPAA relates to the interpreting field. So most people, including interpreters, know HIPAA as the assurance of confidentiality for our protected medical information. If you plan on working in the healthcare industry, understanding the HIPAA requirements is extremely important. To get a better understanding of HIPAA, it is important to establish how it directly impacts interpreters as well as interpreting agencies. So first, let's define HIPAA. HIPAA stands for the Health Insurance Portability and Accountability Act. It was established on August 21, 1996. Before it became enacted into law, there were certain criteria that Congress had to follow. And since not all the criteria was followed, the Office of Health and Human Services, also known as HHS, established privacy regulations in regards to an individual's health information, which later on the Privacy Act was established. So most people recognize HIPAA by its emphasis on confidentiality, but there is also another major portion of it called portability, meaning employees are able to transfer to another employer without losing their health coverage. HIPAA also protects people's individual rights, including those people with pre-existing conditions. Another part of HIPAA that relates to the administrative process or simplification. This provides a new strict requirement regarding electronic healthcare data for billing and payment. So this really allows for patients to access their information while also limiting it to those people who can access the information. In the interpreting field, confidentiality is extremely important, and we have a duty as interpreters to follow the Code of Ethics, also known as COE. So the privacy rule is an important part of HIPAA because it relates specifically to interpreters. The rule established federal protection for an individual's health information. It outlines the information that can and cannot be shared, but it also addresses with who that information can be shared with. So there are four main groups that the information can be shared with. The first is health plans, such as medical or dental or vision, people who in that group. The second is healthcare clearinghouses. Third is healthcare providers, and the fourth is business associate. So the main one that we're going to focus on now is the business associate, since it directly relates to interpreters as well as interpreting agencies. So the privacy rule allows the covered entity group to disclose protected information to the interpreter. If there is any misuse of that information, penalties will happen and fines could be involved. So under the new privacy rule, if an interpreter is not a member of the covered entity workforce, they must sign a business associate contract with that group, stating that all information that is provided to them remains confidential. So being a part of the healthcare team, it is important for interpreters to know the laws that are involved to assure accountability. We, as interpreters, now have the responsibility to follow both the Code of Ethics as well as HIPAA, including the privacy rule, so that we are compliant as interpreters in the interpreting field.